Hey YouTube, it's Donna. It's the end of week 15 and we're almost finished with our clinicals for fundamentals, and it's been pretty good. Monday was our last day at the acute care hospital, so we went to the long-term care facility. We have 2 more days. It's a little slower pace, but I really liked the hospital setting at the acute care center last week. So we're at the nursing home and the long-term care facility, and we have a patient, and we have to do the same thing we did last week. Was that we had to gather information on our patient, like all the medications that we're on. We had to make drug cards to help us remember. We had to know why the patient was taking that particular drug. We got to do full care for that patient, and which was if they needed to go to the bathroom, we gave them their medication, we gave them the injections, we did check their sugar if they were diabetics, and what else, laid them down if they needed to be laid down, if they were tired, bed baths. We did all of that. So like I said, it was a little more slower pace. Did a lot of data collecting, and we had a form we had to fill out. We also had to do a care plan, 2 of them as a matter of fact, and we had to find out. We had to determine like what was the most critical diagnosis for them, or why they were in there, why they came in there initially or was transferred. So it was really interesting. Had a really good instructor this week. My instructor is in the hospital that would have been with us, that was with us last week. So I'm praying for a speedy recovery for her, and hopefully she comes back. But we have another excellent instructor with us, and she's just down to earth. She just tell it like it is. She don't sugarcoat anything, and I think that's why I like her. She don't, if you ask her a question, she gonna tell you the truth, and I really like that. She made me feel more at ease. So anyway, we've been practicing injections and stuff. So I have these are 2 syringes for diabetics. It's strictly for insulin. This is a 100-unit syringe, and this is a 50-unit syringe. So depending on how much the person might need determines which syringe you're going to use. This is subcutaneous, and we use this syringe to give TB shots, or taking skin tests, TB skin tests. So anyway, those are a few things I get to practice with. We had a really good nurse showing us around, or just telling us about different things, different stories that can happen, and things to watch out for. She helped us out a lot. She wanted, it's nice when you have other nurses that are very receptive and want you to learn and want you to get it, and that made our experience pretty good. So like I said, it's almost the end of clinicals, but so far we passed and took a final on. We actually took our final on Thursday. I didn't do so well, but I was pretty much passing the class. So even though I didn't do real well, I still did pass the class. So I was happy about that. Friday we did do our evaluations, and we had to sign them, and I did pass that. So I'm happy that I'm passing. I kind of calmed down a little bit on getting, trying to pass with these A's and B's and things like that. But I know the information. I know I can answer the questions when asked. So I'm leaving it at that, but I'm still trying my hardest. And if anyone think nursing school is easy, it's not. It's not necessarily hard, but it's a lot of time consuming. These are people's lives, and I can't stress this more than once or twice. These are people's lives, and we're trying to help them maintain their life. So any wrong measurement, any wrong thing that you do can cost somebody their life. and that'll cost you your mental status and your license. So anyway, I just want to give y'all that. I'll give you an update soon, and we'll talk later. All right, bye.